Hi everyone, welcome back to my channel, and this is Dr. Khushbu, specialist pathologist currently practicing in UAE, and basically I'm a doctor from India. So on this channel, as you might be knowing by now, we help medical professionals to take a leap in their journey as a practicing professional in UAE, and the topic for today's discussion is about the pattern of examination. See, why I feel that this is an important topic to discuss, or this is an important information to reveal, is I have felt the heartbreaking experience in regard to the same. See, what happened when firstly I prepared for DHA examination, I was pretty clear that it is a CBT MCQ based examination. So I invested 8 months and I cleared the DHA examination, but later on when things changed and I further decided to go for DOH examination, I started doing research about the exam pattern, that whether it will be similar to DHA examination or it will be any other kind of exam pattern which I'll be facing. I was not sure about it. So what I did, generally what people of this category in this situation do, I take help of Google, and in all the articles that I searched or I went through, it showed me that it is an MCQ based examination, because at that very moment when I was back in India, I was not knowing that there are this different designations, GP, specialist and consultant. So I was searching it as an overall doctor, and the Google was saying for DOH, for doctor, it is MCQ based examination, it is CBT. So I believed that, and I started preparing for the same for 2 more months as if it's gonna be MCQ based examination. But luckily, when I contacted some of the people working here, they revealed me that no, it's not a CBT examination and it's a oral assessment type of examination, and that thing was like heartbreaking as well as eye-opener to me. So that is the basic purpose of today's video, that I do not want you people to go through the similar situation, so that you can have the clarity of mind and you can save ample amount of time and money as well as energy. Alright, so to begin with, for GP and dentist, all 3 examinations like DHA, DOH and MOH, they are CBT. And by saying the word CBT, I mean it is computer based examination. But for specialist and consultant, DHA and MOH, these 2 are CBT examination, and DOH is oral assessment here, where you'll be checked for your practical skills and the Viva examination. Coming back to the CBT for DHA may ask you to go for the oral assessment if you are fitting into specific criteria. By saying the word specific criteria, I mean that it has been clarified on their website, the official website or the PQR document, that if you have cleared your education or if your degrees are from specific countries like Portuguese, Korea, China, Iran, etc., you need to further do the oral assessment to apply for the license. So this is the specific scenario where after clearing CBT examination, they may ask you to undergo oral assessment in DHA as well. But in DOH, it's all in all oral assessment for specialist doctor. Mind my words, it is for specialist doctor. For GP and dentist, that is the CBT based examination, similar for all 3 examinations. Okay, with this, let's just go in detail about this CBT examination. I mean to say, what will be the type of questions. So we are aware that it will be like multiple choice questions, and there are gonna 4 choices from which we need to select the correct or the nearest possible answer. But nowadays the scenario has changed upside down from the bygone era, and it is not something that you are getting theoretical one-liner as a question. Mostly the authorities or the exam bodies have made this exam equally competitive to US and Canada board. So this will be, I mean, around 90% cases will be 90% MCQs will be case based questions, where you'll be having 6 to 7 lines describing the clinical scenario of that particular patient, and then you'll be asked the respective questions related to that case as a multiple choice question. I hope it is getting clear in your mind. So all in all, if we see, it's like around 150 questions you will face in the duration of 3 hours, that is around 160 to 180 minutes allowed. So if we calculate, you'll be getting around 90 seconds per question. And believe me, it's really a tough situation, because if you are not well prepared, you'll waste your first 60 seconds of solving that particular MCQ in only reading the scenario, because it's 6 to 7 sentences long. Okay. Also, you can get photographic representation, for instance photographs of USG, chest X-ray, CT scan in radiology, or photographs of slides of like follicular lymphoma or electron microscopy photograph or HPLC graph as an MCQ exam, as a MCQ or a part of an MCQ in your CBT based examination. So it is also important that you go for this all pictorial memory while preparing for this examination. And one last thing is that there is no negative marking for this CBT based examination. So I request that even if you are not sure, go and tick one option, the nearest possible answer you are considering, just tick it, don't just leave it blank, because there is no negative marking. There are 50% chances that you may get the correct answer and you get the mark for that particular MCQ. And last but not the least, that the passing score and the cutoff criteria for the result to be pass is 65%. If it is more than 65%, the result will be pass, and if it's lesser than that, it will be fail. However, I have heard that it differs from your country of origin. Sometimes it can differ if you have completed your education from India or Pakistan or other countries, so it may vary from country to country. So this was all in nutshell about the exam pattern of different licensing examination for UAE for medical professional. I hope this information is helpful to you, and if yes, kindly share it with your friends so that it can reach more people. And if you would like to add on something, surely let me know in the comment section. Thank you for watching. Have a good day.